Hey guys, how you doing? In today's video, I'm going to answer a question which I get asked quite a lot, and this is, if you're having a full set of implants, if you're having an all-on-4 or whatever it is it better to have the teeth sitting on your natural gum, or is it better to have fake gum? Now, the answer to this, like the answer to anything related to implants or cosmetic dentistry, is probably not as easy as you might think initially. You see, there's 5 categories for what we call full arch dental treatments, and I'm going to explain these 5 categories to you because the first 3 relate to how much gum, or have you got fake gum or long teeth, or what's the kind of design that we have in place there. So the terminology here is slightly complicated, but let me help explain it. We've got 5 categories. Let's call them 1 to 5. Okay, so we've got 1, 2, 3, 4, 5. And the first 3 of these categories relate to fixed set of teeth. Okay, so what I mean by this is you have the implants placed in the bone, and then you have teeth which are not removable by the patient themselves, screwed into these implants. Okay, so if we have teeth which are fixed, we call this fixed prosthetics. So we're going to call number 1 to 3 FP for fixed prosthetics 1, 2, and 3. Now the other 2 are removable, so we're going to call these removable prosthetics RP4 and RP5. Okay, so let's explain what all of this means. So let's look at the FPs first of all, FP1, 2, and 3. And the only difference here is what it looks like at the gum level. So we have our implants. FP1 is those situations where we don't have any false gum, and the teeth are at an average height to width ratio. So in ideal aesthetics, what we want is the width of the tooth to be about 75 to 80% of the height of the tooth. Okay, so I'm really talking about the front incisor tooth there. And the gum level is dictated by wherever your gum level ends up being after you have teeth taken out. So remember, when you have teeth taken out, the gum and the bone shrink away, and quite often it goes up for the top and down for the bottom. So that we can't really change that. Okay, it's very difficult to change that. Doing bone grafts and tissue grafts to increase the height of bone is notoriously very, very difficult. It's not impossible, but it's very difficult. Now, if that's our fixed position of the gum, wherever it ends up once your teeth are removed, we now have to decide how long we want. Where do we want the incisal edge of the teeth to be? And this is related to the position of the lips, actually. So in the vast majority of cases, we look at the position of the lips, we take into account the age and the sex of the patient, and that kind of gives us a good guideline on where the incisal length should be. So ladies will show more tooth than men, so their tooth, the visible tooth at rest, is going to be longer, so their teeth are more visible. Guys, we show less tooth, so about a millimeter less for the same age group. But as we get older, men and women will show less and less top tooth and more lower tooth. So we take all of this into account, and that dictates the bottom edge of the teeth. So you can see by now we don't actually have a lot of control over the bottom edge, the incisal edge of the tooth, and where the gingival margin, i.e. where the tooth and the gum meets. Because when we place implants, both of these are really out of our control. We're trying to make the teeth look right for the patient, and we can't change the gum height, and we can't change the position of the lips within reason. So now we've got these 2 kind of landmarks, and that tells us what the height of the tooth is going to be. Okay, now in an FP1 situation, there is very little bone loss. Okay, once the teeth come out, there's very little bone loss, or the teeth have been taken out strategically and implants placed strategically so that you can maintain the look of the gum. Okay, so this is the hardest thing to do, is maintain these pink triangles in between the gum. We call these the papillae. And by taking teeth out selectively, not putting all of the implant in at the same time, you stand a better chance to maintain the papillae. Now, the only downside for this is you have to start from a situation where you've already got papillae and you don't have aggressive gum disease. So if you've got aggressive gum disease already, you've lost lots of bone, it's going to be very difficult to maintain these papillae. So maybe we should look at another option. Now, the FP1, I'll be honest, I've never done one because I just don't think they look very aesthetically pleasing. There's no real advantage in my head from a purely clinical and functional point of view why you would want to keep that, keep the papillae, keep the uneven gingival architecture, the arcs around all of the teeth, and why you wouldn't go for something having a fake gum. So the fake gum solution is actually FP3. I'm going to come back to FP2 in a second, but FP3, what you do is you accept that you've got bone loss. At the top it will go up, and you actually quite often remove more bone. So we'll remove the bone so that we can hide that transition line between the denture or the all-on-4, whatever it is, and the natural gum. And so we hide that up high underneath the lip so it's not visible. Everything which is visible is now made fake. Okay, so we've got fake gums and fake teeth. Now the real advantage of this is that we can make this look really, really good. We can be very natural looking. Here are a couple of photos of real cases, and all the gum you see here is completely fake. Now, the advantage here is really in the aesthetics because we've got full control of the height-width ratio of all of the teeth. So you remember I said the incisal edge is dictated by the general look of the face of the patient, the age, the sex, all of this kind of stuff. And the gum position is dictated just by the clinical situation, how much bone is there and what's the actual treatment plan. Now, this means we can't get this ideal height-width ratio to the teeth and can't have the teeth the ideal length. So if we have fake gum, we've got complete control. We can have the teeth exact height that we want, the exact width that we want. We can create that perfect smile for the patient because we don't have the limitations of trying to make the smile fit to wherever the gum line is going to be. We can create our own gum line. In addition to this, we can create very sharp, natural, youthful looking papillae in between teeth. And from an aesthetic point of view, this is really important if you're trying to achieve that really youthful, nice smile. You're trying to get a smile which fits you and makes you look good. Okay, because there's certain aspects of a smile which, if you get it wrong, it can look like dentures and it can make you look quite old, which is obviously not what we want to do with these kind of treatments. So these are our two examples. We've got FP1 and FP3. FP2 is in the middle. So FP2 is if we accept that we don't want fake gums and we are happy having abnormally long teeth. Okay, now this sounds a bit weird, but in a lot of cases we can get away with this because we're treating people who don't naturally show a lot of gum. Okay, so if someone doesn't show a lot of gum, then there's no real reason why you would want the aesthetics to be fantastic up near the gum because it's never going to be on show. Now, saying this, I've never done a full arch case with extra long teeth. Okay, what we tend to do is maybe bridges and things like that. So here's a photo of a guy who we recently did a lower bridge on, and exactly the same situation. The bone has been lost over time, and that means we ended up having very long looking teeth. Now in real life this isn't obvious because all he shows is about 2 to 3 millimeters of the top of the teeth. Everything else is hidden below the gum. So that's what we've got. We've got FP1 with no gums average height width ratios, everything generally looks good, but we're still compromising on papillae. We've got FP2 where we have naturally long teeth because the bone has been lost, papillae has been lost, so the teeth end up looking longer. And we have the FP3 where we have fake gum to compensate for all of this bone loss, which either we do as part of the treatment or has happened as part of gum disease. Now, those are our three solutions in terms of fixed prosthetics. Our two removable prosthetics options are very similar. Now, both of these will have gums, so fake gums. And one FP5 is the RP5 is the one which I do most often, which is the clip-on dentures or the clip-on teeth. So you have your implants placed, you have what we call locator attachments put into the implants, and then the denture is clicked into the implant. Okay, this is different to a normal denture, because a normal denture would normally cover the roof of your mouth and they're quite bulky, but these tend to be much more slimline dentures which click into the implants. Now, the other way of doing this is having a metal bar which is fixed into the implants. Okay, so this metal bar links all of the implants, and in all of the fixed prosthetic stuff, the metal bar is within the teeth, but here the metal bar is a separate thing and is screwed into the implants on its own. Then the denture is clicked into this metal bar. Now, the difference between the FP4 and 5 is a little bit technical. It comes from where the support of the teeth is derived from. So with an FP4, where we have the metal bar, all of the biting forces are going through the implants. When the patient bites, there's no pressure on the gum because all of the biting pressure is transmitted into the bar and then therefore into the implants. Okay, just like any of the fixed prosthetic stuff. Now, with the RP5, sorry, I always get these mixed up a little bit. With the RP5, what we have is the gum takes some of the loading as well. So the denture sits on the gum and is then clicked into the implant. So as you bite, there's pressure on the gums and the implants. Okay, whether this really makes a difference, I don't know. I imagine it adds a little bit of sensation in terms of how hard you're biting on things. But as I say, the vast majority of the removable kind of teeth which we do are the RP5, where we don't have a bar. Okay, adding a bar adds a lot of complexity and cost to the treatment, and having a bar and then a denture clicking on, cost-wise, would be almost the same as the fixed teeth. So almost every single one of my patients would say, well, why don't I have fixed? Because perception-wise, it seems like a better solution. So I hope this video answers the question about, should you have gums, fake gums? What are the advantages of fake gums? Really, it's not a kind of a choice. It's what is the most appropriate thing for your kind of bone loss or your individual situation. Some people lose loads of bone when they have their teeth taken out. Some people hardly lose anything. So a lot of this depends on what your individual situation is, how your lips frame your smile. When you smile widely, how much gum do you show? And what's the height width ratio of the teeth which are going to be fitted into the implants? Okay, so as I say, I come from an aesthetics background first, and then I do the implants to fit around the aesthetics. And for that reason, I don't think there's anything which is better looking than having fake gums. Okay, and fake gums have come a long way. They don't look like cheap dentures anymore. Okay, you can see from these photos, they do look pretty natural. In fact, I put this before and after on Facebook and Instagram a little while ago, and a lot of people were questioning whether these are actually real or fake. Okay, so I hope you got something out of it. If you did, give it a thumbs up. If you got questions, comments, you can leave them down below. All right, and I will see you in the next video, guys. Take care.